Medicare RUC exit, specialist pay battle, quality risk.
Welcome to Expert Billing Talk. Today we're getting into a really important shift in how Medicare might start paying doctors and what that means for, well, everyone involved, doctors, practices, and you. So, okay, let's start here. CMS, the Centers for Medicare and Medicaid Services, they've put forward a pretty big proposal for 2026.
That's right. And what's really significant here is CMS seems to be stepping away from relying so much on survey data from this really influential panel, the RUC.
The RUC, right, the Relative Value Scale Update Committee.
Exactly. Formed by the American Medical Association, the AMA, and other physician groups way back in 1991. And, its influence on Medicare payments has been huge. CMS pretty much always took their advice.
Almost always. Wow. So moving away from that is a big deal.
It really is. And there's no parallel for this on the hospital side, by the way. This is specific to physician payments.
Okay, so what does this proposal actually do? What are the immediate effects we might see? Well, the proposal suggests that payments, reimbursements, for almost 9,000 specific billing codes could drop by about 2.5%. And these aren't minor codes. Most are tied to specialty care, things like surgery, diagnostic imaging, pain management, orthopedics.
So specialists are definitely feeling the focus here?
Yes. CMS frames it as an effort to put more resources towards primary care. They say it's about aligning payments with modern practice and supporting value-based care.
Value-based care meaning paying for good outcomes, not just more procedures.
Right. They're calling this an efficiency adjustment for codes that, frankly, haven't been looked at in a long time. Some for 18 years on average.
18 years.
Yeah.
Okay. But you said it's not hitting everyone equally. Primary care gets treated differently.
Correct. Family medicine, general primary care docs, they wouldn't see the same impact. The codes they use most often think evaluation and management visits, EM codes, behavioral health, some maternity care, telehealth. Those are largely exempt from these cuts.
Okay, that raises the obvious question then. If specialist payments go down, where does that money actually go?
And that's the absolute crux of the issue. See, federal budgeting rules, the law, actually says CMS cannot increase or decrease overall Medicare spending just through these payment rules.
Budget neutrality always comes back to that.
Always. It means any money saved from cutting payments for, say, a surgical procedure has to be shifted somewhere else. It must be redistributed to boost payments for other services. So, yeah, it's basically a zero-sum game.
And that explains the tension. You've got primary care doctors versus specialists essentially fighting over the same pot of money.
It definitely intensifies those long-standing disputes.
Which leads to the pushback we're seeing. The AMA, other groups, they're sounding the alarm, right?
They are. They're warning that if specialists see their payments cut, they might feel pressure to, see more patients, maybe faster, just to keep their revenue stable.
Which could put quality and safety on the line. I heard one leader quoted as saying, "Nobody wins." That really sticks with you.
It does. It paints a picture of unintended consequences, even if the goal is to support primary care. Think about a gastroenterologist doing a colonoscopy. They're trained, really drilled, to take at least 6 minutes to carefully look for polyps.
Right, that's a quality standard.
Exactly. So the worry is if the payment for that procedure goes down, does that create pressure to maybe rush it, even slightly?
Which directly undermines that whole idea of value-based care you mentioned earlier. Speed over quality.
That's the fear. It seems contradictory to the stated goals.
Now, the AMA's argument is rely on experienced doctors, the RUC. But the RUC itself hasn't been without critics over the years, has it?
No, it hasn't. There have been criticisms about potential conflicts of interest, questions about whether the valuations were always accurate or if they sometimes, perhaps, favored specialist procedures.
So CMS might feel they have justification based on those past critiques.
It's part of the context, yes. And it's worth noting, CMS has kind of been setting the stage for this shift for a few years now, trying to find ways to boost primary care and address what they saw as issues with the RUC data.
Still, even groups like the American College of Physicians, who support valuing primary care more, are urging caution. They don't want patient access to specialists to suffer.
It's a very fine line to walk.
It really is. Promoting efficiency, boosting primary care, but also making sure you can still get high-quality specialty care when you need it. That's the tightrope. Navigating these complex payment changes and maintaining a healthy revenue cycle is a huge challenge for practices right now.
Absolutely. Keeping up with rules, ensuring accurate coding, fighting denials, it takes constant effort.
Which is why services like human medical billing exist, They actually help practices in the U.S. fix those billing problems, improve their collections, and really get a handle on their revenue.
That kind of expertise can make a real difference, especially with chefs like the one we're discussing.
Definitely. If you're running a practice and feeling overwhelmed, check out their website. It's humanmedicalbilling.com. They also have a great free weekly newsletter, the Expert Billing Newsletter, with insights like these.
Good resource.
And they offer completely free practice analysis. No strings attached, no commitment, just a chance to see where things stand. Worth looking into at humanmedicalbilling.com. So, wrapping this up, these Medicare proposals really put a spotlight on a fundamental tension in healthcare financing.
It really does. And it leaves you thinking, right, how will this impact the way specialists practice day to day? And ultimately, what's the effect going to be on the quality, the accessibility of the care that you receive down the line? What part of this whole situation stands out most to you?
Lots to consider. Thanks for listening to Expert Billing Talk. See you next time.